Dr. Thomas Gill is a leading gerontologist at the Yale School of Medicine. He's currently doing groundbreaking research on the effects of testosterone on older men. Testosterone replacement is a hot topic right now in medicine. Dr. Gill joins us now to tell us about this trial study into the benefits and drawbacks of testosterone for men at 65 and older. Welcome. It's great to see you again,
Good morning,
Dr.
Jocelyn.
Gill.
Thank you for having me.
Are you the principal investigator of this study?
I am. I'm the principal investigator at the Yale site. Yale is one of 12 sites in the country involved in this clinical trial.
Okay, so tell us about this clinical trial. Why testosterone?
Good question. When men age, they often develop a variety of different symptoms that are attributed to aging, such as having difficulty walking, being more fatigued, perhaps slowing down mentally. And we often attribute these symptoms to age when in fact it could be due to another problem. And we're studying whether these problems could be due to testosterone, low levels of testosterone in the blood.
So do most men deal with these types of symptoms you just described? Is it something that they would normally just have to deal with?
Well, usually they're just, they and their physicians and their family are just attributing these changes to age alone. And testosterone is not a test that's done routinely in clinical practice. So a lot of these men are undetected in terms of having low levels of testosterone. Now, we don't know whether low levels of testosterone are causing these symptoms, and so we have designed this study to determine whether treatment with testosterone among men who have these low levels of testosterone with these symptoms can reverse these symptoms that are often attributed to aging alone.
All right, typically this is a subject that a lot of men don't even really like to talk about.
Well, that may be the case, and so would also ask the spouses or the children,
right,
to see or determine whether your husband or your father are having some of these changes, and check with their physicians if they've ever had testosterone tested. Otherwise, they can come in to our site, which is located at Temple and George, and we have free screening. We do initial screening over the phone. We bring these men in, we do blood tests for low testosterone. If the test is low, that test is repeated, because we're looking for men who conclusively have low levels of testosterone.
What have other studies, earlier studies, shown us about testosterone?
They've shown that testosterone replacement can improve muscle strength. But that's not really a meaningful outcome for most men. They're interested in, can they walk faster? Can they get up the flight of stairs? Can they carry heavy packages? Can they perhaps get rid of the feelings of fatigue? Perhaps they're having some problems with their sexual function. They're losing interest in sex. These are all symptoms that potentially are responsive to treatment with testosterone.
Well, what do you expect to find in your clinical trial?
Well, we're going to be treating men. It's a randomized trial, so half the men will get the testosterone gel, which is just placed right on the skin. It's a gel. Or they'll get a placebo formulation of the same gel, and they'll be treated for a year. And at the end of the year, we'll determine whether men who were having difficulty walking are no longer having difficulty, or whether they can walk more quickly, whether their symptoms of fatigue have resolved, whether their interest in sex has improved. We're also looking at changes in bone and in cardiovascular health. There's some evidence that low levels of testosterone can contribute to atherosclerosis in the heart and to perhaps myocardial infarctions. So we have ancillary studies to the main study looking at bone and heart function, and these are two areas that should be of great interest to men.
And how can they sign up again, Dr. Gill?
Well, they can call us at 203-737-5672.
And you need as many men as possible to participate.
Right, we're aiming for about 68 men at Yale, and we've already enrolled 28, so we're not quite halfway there. And we're going to be enrolling for the next 12 to 18 months.
So it could be a way for men to regain some of their youth back?
Well, that's, the testosterone is the hormone of the male hormone.
Yes.
And we think that replacement may be beneficial among aging men.
All right. right, Dr. Tom Gill, thank you so much for joining us.
Thank you very much, Jocelyn.
You're welcome.